Cultural competence is crucial for speech-language pathologists, SLPs, to provide effective and equitable services to clients from diverse backgrounds. Training SLPs to be culturally sensitive and responsive involves several key components, including understanding cultural differences, recognizing biases, and developing skills to communicate and interact effectively with clients from various cultural backgrounds. Here are some strategies and methodologies for training SLPs in cultural competence. Components of cultural competence training for SLPs. 1. Awareness and self-reflection. 1. Cultural self-awareness, encouraging SLPs to reflect on their own cultural identities, values, and biases. 2. Implicit bias training, helping SLPs recognize and address implicit biases that may affect their interactions and judgments. 2. Knowledge and education. 1. Cultural knowledge, providing information about the cultural backgrounds, traditions, and communication styles of the populations SLPs serve. 2. Health disparities, educating SLPs about health disparities and how socioeconomic factors and systemic issues can impact access to services and treatment outcomes. 3. Skills development. 1. Effective communication, training in culturally sensitive communication strategies, including the use of interpreters and alternative communication methods. 2. Cultural adaptation, learning how to adapt assessment tools, intervention strategies, and materials to be culturally relevant and appropriate. Training strategies and methodologies. 1. Formal education and coursework. 1. Curriculum integration, incorporating cultural competence training into the core curriculum of SLP programs, including courses on multicultural issues and bilingualism. 2. Continuing education, offering workshops, seminars, and online courses focused on cultural competence for practicing SLPs. 2. Experiential learning. 1. Cultural immersion, providing opportunities for SLPs to engage with diverse communities through fieldwork, internships, or volunteer experiences. 2. Case studies and role-playing, using case studies and role-playing exercises to simulate real-world scenarios and practice culturally responsive interventions. 3. Mentorship and supervision. 1. Mentorship programs, pairing less experienced SLPs with mentors who have expertise in cultural competence and can provide guidance and support. 2. Reflective supervision, encouraging reflective supervision practices where supervisors and SLPs discuss cultural issues and reflect on their experiences and challenges. 4. Community engagement. 1. Partnerships with community organizations, collaborating with community organizations that serve diverse populations to gain insights and build trust within the community. 2. Community feedback, seeking feedback from clients and community members to understand their needs and preferences better and to improve services. 5. Use of technology. 1. Online resources, providing access to online resources, such as databases, articles, and training modules focused on cultural competence. 2. Telepractice training, training SLPs in the use of telepractice to reach clients in remote or underserved areas, while ensuring culturally competent care. 6. Assessment and evaluation. 1. Cultural competence assessments, using self-assessment tools and formal evaluations to measure SLPs' cultural competence and identify areas for improvement. 2. Client satisfaction surveys, collecting feedback from clients about their experiences and the cultural sensitivity of the services they received. Key areas of focus. 1. Language and communication. 1. Bilingualism and multilingualism, understanding the linguistic needs of bilingual and multilingual clients, including code switching and language dominance. 2. Interpreter use, training on the effective use of interpreters and the importance of ensuring accurate and respectful communication. 2. Family and community dynamics. 1. Family involvement, recognizing the role of family in different cultures and involving family members appropriately in the therapy process. 2. Cultural norms and values, understanding how cultural norms and values influence communication styles, behavior, and perceptions of therapy. 3. Ethical and legal considerations. 1. Cultural sensitivity in assessments. Ensuring assessments are free from cultural bias and accurately reflect the abilities and needs of clients from diverse backgrounds. 2. Equitable access. Advocating for policies and practices that promote equitable access to SLP services for all clients, regardless of cultural background. Resources for training. 1. Professional organizations. Utilizing resources and guidelines from professional organizations, such as the American Speech-Language Hearing Association, ASHA, which offers cultural competence resources and continuing education. 2. Literature and research. Keeping up to date with the latest research on cultural competence and integrating evidence-based practices into training programs. 3. Diversity committees. Establishing diversity and inclusion committees within SLP programs and workplaces to promote ongoing education and initiatives related to cultural competence. By incorporating these strategies and methodologies, SLPs can develop the cultural competence necessary to provide high-quality, responsive, and equitable services to clients from diverse backgrounds.